All right, we're live.
All right, thank you. We are back, and it is continues to be February 9th. But we did have a little hiatus to move in with natural resources and energy, and now we're back. And it was an excellent discussion in the joint meeting regarding PCBs, and I think extremely helpful to us going forward. Jen has brought us the flexibility bill. And do we have a new draft? Okay.
Yes.
I just want to make a comment before we start. I know we started to get into a discussion about having a list available for practitioners out of state working with patients in state, and so I want to just a reminder that this bill is really meant to prolong the availability and access to healthcare with deadline flexibilities on the stuff that we have been looking at. So I'm I would be concerned about adding in a new program or a new activity at this point. So, and just keep that in mind. We're still in the middle of a pandemic, even though we feel better because we know the vaccine is there. But nevertheless, putting new requirements out for either practitioners or administration, for me, it becomes problematic. So that was my thinking over the weekend. But Jen, I'll let you take us back into the bill.
Okay, great. And you will, I think, you may see some of what you're talking about that I put in for you to look at based on your discussion last week. So obviously we can take any of that out. Do you want me to put up the document?
Yes,
Is that
please.
the best way to do it? Okay. All right, great. Can you see my screen now with the new draft?
Perfect.
Okay, so the main thing, so Jennifer Carby, Legislative Counsel to start. The main thing that this one does is to go through and put that March 31st, 2022 date in, but there are also some other changes that I made in response to your discussion on Friday, I think it was. So I will just show you all of those changes. I think I've highlighted all of the changes in bold and yellow. So again, you'll see throughout, instead of having that language about this flexibility lasting for the duration of the state of emergency and for 3 months after, I've instead just extended out for those that were already March 31st, extended that date a year. And for some others, changed the date to be March 31st, 2022. So the first section that affects is this overall Agency of Human Services flexibility provision. And then again, for the employees of healthcare providers and facilities who are not themselves healthcare professionals. And again, for the Agency of Human Services administrative rules, flexibility, and that list. And I do just want to flag here that there is, in addition to some specific rules that you gave flexibility around and that continues now, there is also this catch-all for other rules and standards for which the Agency of Human Services is the adopting authority under the Administrative Procedures Act. And I know this has been an issue for some of the commissioners in the Agency of Human Services who want to see this flexibility continue. So I just wanted to make sure you knew that this was already built in and would again be extended by extending this date until through March 31st, 2022. Then we get to the Medicaid and health insurers, and this is the provider enrollment and credentialing. And so this I changed for this draft. Under the current provisions, it lasts until the last to terminate of the declared state of emergency in Vermont, the declared federal public health emergency, and the declared national emergency. And there had been a request from some of the providers to change this as well to a date certain. So if in the spirit of doing that, if that's what this committee chooses, then this would be until March 31st and not based on that termination language. And I think we may have looked at a version of this last week because I have taken it out of bold and highlight, but this is the subsection B was the part that said if there's another state of emergency, then this provision kicks in again. So that would not happen. It would just run straight through until the end of March of next year. And we had the prescription drugs and the early refills for maintenance medications. This was also, right now, this runs through June 30th. This instead would have it go through March 31st of next year. And extensions for the buprenorphine prescription renewals without an office visit, and for the flexibility for the Agency of Human Services to reimburse long-term care facilities and other 24-hour-a-day services for their bed hold days. Then we get into regulation of professions, and there are some additional changes in here. So this is the Office of Professional Regulation and Board of Medical Practice and those out-of-state healthcare professionals. So the first thing this would do was have this provision run through March 31st, 2022. I know you heard different perspectives from the Office of Professional Regulation and the Board of Medical Practice about the timing of this provision, but it was my understanding from your work on Friday that you had chosen, at least for now, to go with this date certain. So March 31st, 2022. And this is what allows someone who is licensed in another U.S. jurisdiction to be deemed to be licensed to provide services here using telehealth. And then I added as a volunteer member of the Medical Reserve Corps. And then we have that, keep the language about on the staff of a licensed facility. And then I added or federally qualified health center. So this is adding those two provisions that you heard about from David Herlihy at the Board of Medical Practice that again allows somebody from out of state to be deemed to be licensed or certified or registered to provide services here as a volunteer member of the Medical Reserve Corps or as a part of the staff of a federally qualified health center.
So I think we know what a federally qualified health center is. We haven't had a lot of conversation in the committee about the Medical Reserve Corps. Do you have a sense of what that encompasses?
Not
we'll
much. I mean,
okay.
I'm looking it up.
All right.
But,
we could do that.
Yeah, I mean, you may want to get testimony. So what it says on their page, and this is why I use the term volunteer, is Vermont's Medical Reserve Corps units are community-based groups of volunteers who supplement local emergency and public health resources with their existing skills. And they receive training in emergency preparedness, prepare for and respond to emergencies, and support health department initiatives.
So these could be some of the folks who are being trained to give vaccinations separate from our healthcare professionals.
Well, in this piece, I mean, the Medical Reserve Corps generally, yes. In this case, we're talking specifically about a healthcare professional who holds a valid license, certificate, or registration to provide healthcare services somewhere else, being deemed to be similarly licensed to provide services here as a member of the Volunteer Medical Reserve Corps.
Okay.
But I think that would still be within the scope of
within their scope of practice.
Licensure, right?
Yeah.
But wouldn't require them to get separately Vermont licensed to be able to provide that level of services through the Medical Reserve Corps. So this is where I expanded in subsection B, expanded that for the requirement to have information submitted to the Board of Medical Practice or Office of Professional Regulation. So if you want to keep this more narrow, we can certainly go back to that. Right now it says a healthcare professional who plans to provide healthcare services in Vermont, and I just put pursuant to subsection A because now there's that list, shall submit or have submitted on their behalf their name, contact information. This was a request from the Board of Medical Practice, all jurisdictions in which the individual holds a license, certificate, or registration. And then I added, based on your conversation last week, whether the individual will provide services using telehealth, and then we keep and the location or locations at which the individual will be practicing. So we can certainly look at how you want to use this piece, this notification to the licensing authorities, and under existing law for these people who are licensed out of state, if they're just doing telehealth, they don't have to register or notify anyone. They can just provide the services. Under this language as revised, those people doing telehealth, as well as someone doing medical reserve corps or working at an FQHC, would have to submit information, notify, or register, however you want to term it, with the Board of Medical Practice and OPR.
So I guess, I mean, so this is one of the things that I've been thinking about, and that sort of the question is this: during the pandemic, and we'll probably hear from the provider group on this, and I do see Senator Hardy's hand up. The question I have is, right now, the problem with the pandemic has been to restrict travel of patients from Vermont to New York, or Vermont to Massachusetts, to get care. So they've been relying on audio visual telehealth. And so under those conditions, I just wonder if we're putting a requirement in for the docs who are providing that care, either in Vermont or out of Vermont. Is it a barrier to access? That's the question. It's a new something at this stage of the pandemic. That's my question. Senator Hardy,
Right.
you have your hand up.
Yeah, I've been thinking about this as well, Senator Lyons, and I talked to some providers in my community yesterday about, whether they had heard of any issues with providers who are providing telehealth from other states, and they hadn't. And their concern about adding this requirement at this point is that the example is that they gave was, there may be a mental health provider in Denver who is providing counseling to a college student who normally is in Denver, but is now here because her college is closed. And that person may be providing care to just one Vermonter because of the specific circumstances. And they wouldn't necessarily know that they have to do this. And so it creates a situation where some people may not follow this just because they don't know that they're supposed to do it. And then it would put into question whether or not those services can be, covered, et cetera. So I'm hedging as well, Senator Lyons, and wondering if we should get more testimony, or if we should just put this on hold, or what. Even though I'm empathetic to the desire to sort of want to know who these people are. So.
Okay. Senator Hooker.
Yeah, thank you. My intent with bringing this up last week was, judging from the Board of Medical Practice, that this was a concern that they had. I'm listening to Senator Hardy and even the Medical Practice Board, that there had really been no indication that there was anything untoward going on. But it just struck me as odd that from the beginning, there was no requirement for these telehealth providers to register at some point. My hope is that the pandemic will end soon and we won't have to worry about it. But and I can see where it is kind of throwing something into the middle of the mix and creating a problem. So as long as we feel comfortable that things are happening well, going along smoothly, then I have no problem with eliminating that. I would hope that if there are any indicators showing that something is happening, that we can relook at, what the office would have to do to cover this kind of gap that was created.
So just Jen, that is it this section? Does it continue any further or just that one
This
section?
section, no, it does. There's also
Yeah,
the
okay.
notice.
It has the
piece.
notice. Yeah, I don't know how you get a notice out to the physician in Colorado for the college student. I think that's really a terrific example that Senator Hardy brought up.
Right, I think that the piece with that is they still will need notice of the fact that the authority to, the deemed licensure goes away as of March 31st, 2022.
Right.
Unless you do
Hopefully the
something different.
pandemic will go away. It's not, but okay.
So
All right,
am
I just want to poll the Senator Terenzini and Senator Cummings. Do you have any passion about keeping this in? Go ahead, Senator Terenzini. You look ready to speak.
I'm not yet, Senator Lyons. I was. I need a stronger prescription of glasses. Is what I need.
So this provision would have those out-of-state physicians who are ordinarily treating patients when they're doing telehealth work during the pandemic to have to notify the state in some
Right.
way. Yeah.
right. So I think the question for the committee is, do you want to just get rid of the notification requirement around telehealth, or do you want any of the rest of the pieces of this? Do you want somebody who's going to be in the volunteer medical reserve corps, and maybe there's sufficient registration through that process that you do or don't want separate notification? Do you want notification about somebody who's going to be working on the staff of an FQHC? So those are the pieces at play. And I do see Senator Cummings is
Senator Cummings,
waiting.
go ahead.
Okay. I think telehealth is different. You can't, my understanding was, because I had a constituent who complained that you can't have a doctor in New York now that does telehealth unless they're licensed in Vermont.
Right.
So doctors should know that, to tell them that they have to notify the state, because a doctor in Denver, if you're in the Medical Reserve Corps, you're working at an FQHC, you're under somebody's supervision. There's some control. Telehealth is wide open. You could have somebody from Russia or China or Yugoslavia.
This doesn't go that far. This one is
It doesn't go that far. Okay.
Right. This is only, the deemed licensure is only for someone who holds a valid license, certificate, or registration in another US jurisdiction.
Okay.
That's who can do telehealth under this emergency provision.
I think a quick email with, by the way, I'm continuing to see my mental health patient that's a college student is, you don't even have to do a stamp in an envelope these days.
How are you going to know? How are we going to know, Senator, that there is a college student and that that college student's being treated in Vermont?
We aren't. I mean, this is all based on the honor system.
Right, but
Does somebody who shows up for the medical corps have to bring their medical license?
during the pandemic, will the where was that physician from? Colorado, I think Senator Hardy said.
Yeah.
Will that physician know? How will
Right.
we?
Right
how-
now, he knows he's not supposed to do it.
Right, but during the pandemic,
So
he's allowed to.
how did he find out he could do it? There's no penalty here for not doing it.
Well, I
Well,
don't
there
know. Is this
right,
under,
so there-
this under practice board
Yes,
professional
because of
Send you a
other,
nasty
because of
letter?
other language that you've put in here. It allow, in Act 91 and Act 140, it does allow the Board of Medical Practice or OPR to take disciplinary action against someone if they're not practicing in accordance with Vermont requirements. I mean, what they would do in the event of someone who was doing telehealth and didn't notify the state, I wouldn't presume to speak for them.
My concern is when we started doing all of this last spring, medical offices were shut down. You could not get an appointment to see your doctor in person for a number of weeks. Now, most of them are open. There may be reasons why you don't want to go. I'm trying to balance the rights of the protecting the patient to making sure that they are getting good medical care and balancing that against access. And if we don't, there's nothing that says there has to be an ongoing relationship with this doctor in Colorado. I could get on, there's all kinds of MedMD right now where you can get on and get an appointment with a doctor. They're all over the TV. I'm just.
So we hear you, Senator. I guess the question is, and we'll have to ask our practitioners this question. We did not hear from the Department of Health, from David Herlihy, that there is a problem. So I hope we don't want to solve a problem that doesn't exist. So,
But we don't want to create one.
And we don't want to create a problem. So far, we haven't done that. So let's go finish. What time is it? I don't want to hold us.
12:02.
Oh, we have to finish.
A caucus.
Yeah, we have a caucus at 12 as Senate of the Whole. Let's come back to this, Jen. I don't know.
Yep, I think we're back tomorrow on this.
Tomorrow, we'll be right back on this. So do some thinking, and we'll have maybe a representative of the provider community come in. Jessa Barnard is ready to discuss this with us, so we'll do that. All right, sorry to go over, apologize greatly. Nellie, we can go off YouTube and we can